Hi, welcome to another episode of Circle Direct. I'm your host, Dr. Tiwa. And going ahead with the routine medical tests I've been going through, we have gone through routine blood tests, we've gone through the routine physical exam, and we've also gone through the routine imaging test. Today, we're going to be specific about some of the auxiliary tests. Firstly, pulmonary function tests. Now, what does pulmonary function test entail? It's in the name, pulmonary. It's about your lungs. It's about how you breathe, how well your lungs are working. Now, when we're talking about routine pulmonary function test, we usually want to know how deep you breathe, whether you are breathing in and out efficiently, because you breathe in oxygen and you breathe out carbon dioxide. So we want to know whether the oxygen you are taking in is enough for your insides, and the carbon monoxide that you're bringing out, or dioxide that you're bringing out, is sufficient enough to exit your body. So now these pulmonary function tests are usually done to check your lung capacity, how deep you are breathing in and out, and also is to diagnose different um, pulmonary ailments like asthma. Asthma, very common in our landscape. We also have what we call a chronic obstructive pulmonary disease. Now, when I say chronic obstructive pulmonary disease, it's in the word chronic obstruction. It means like when you are breathing in and out, it always seems like there is something impeding the flow of your breathing. Now, if that has been consistent over time, that's where we have what we call a chronic obstructive pulmonary disease. We also have what we call an interstitial lung disease that usually affects the lungs themselves. So it can be an infection of the lung parameters, what makes your breathing sufficient. Now, what's the most common type of routine pulmonary test? What is the most common is what is called the spirometry. Now, what is the spirometry? It's actually a fun little device which has a part for blowing in air, for blowing air into forcefully. And then we have what we call these three chapters of that same instrument, where you have different balls in either green, yellow, and blue, or red, yellow, and blue. So when you force air through that spirometer, you see if your lungs are functioning properly, you see that the three balls will go up and then come down. So that is the standard test, just to check how you exhale forcefully. It helps to diagnose asthma and chronic obstructive pulmonary disorder. You know, when I said there's a chronic obstructive pulmonary disorder, it means like there seems to be an obstruction with how you breathe in and how you breathe out. So when you do that forceful to the spirometer, because there's an obstruction there, or maybe because there's something impeding how you're breathing, all the balls might not go upwards. Maybe one will go up or one will go down, or those kind of things. It wouldn't be good enough in terms of if you have any of these diseases. Another test that's usually done in terms of pulmonary function test is what is called a diffusion capacity test. So this one measures how your lungs is able to transfer the oxygen that you breathe into your bloodstreams. It helps you to see how your lungs are able to transfer that oxygen to places that need it. Now, this test helps to check how your lung is able to exchange gases, especially in interstitial lung disease. Now, in interstitial lung disease, we usually have some capillaries that move oxygen to carbon dioxide and makes the carbon dioxide come out. Now, if there's a problem with your interstitial and there's interstitial lung disease, this diffusion capacity helps to get it figured out, because you would see that your lung is not effectively moving oxygen around your body. There are also other pulmonary function tests that help to check your lung volume. Of course, spirometry is one thing that can help, especially when you breathe out, to see how much you are breathing out. Now, how frequently do you want to do this routine pulmonary function test? This is dependent on your healthcare provider and what symptoms you might have or what risk factors that you have. For instance, if you are a chronic smoker, for instance, if you have smoked for about 20 years of like 1 or 2 packs a day, you would want to do more frequently a pulmonary function test, because it is essential to know where you are in terms of managing your respiratory health. Now, don't hesitate to contact your healthcare provider if you've noticed any such symptoms. Maybe you have wheezing. Wheezing is wheezing sounds in your breathing. You would hear that tinge sound when you're breathing. Or if you have any symptoms that have to do with how you're moving out oxygen, moving out carbon dioxide and breathing in oxygen, the way you're breathing, you would always know when something is off when you are breathing. So make sure to inform your healthcare provider when you notice any differences with your breathing. You have to understand that the lungs are very important. So take care of them as best you can. Now we've come to the end of another episode of Seco Direct. If you have any questions or anything that you want us to know, please, the comments are all yours to fill and get back to us. I remain your host, Dr. Tiwa. Thank you very much. Take care and stay well.